challenge. But what has compounded this situation is the presence of what we call a variant. It's a variant which we call 501.v2, which is basically an indication of a slight change in the structure of the virus. Now, this is not only a South African phenomenon. We've seen a similar thing has happened in the UK. We've seen it in Brazil and Australia, although the variants are slightly different. And in our case, there has been an indication that our variant is quite different from the one that's happened in the UK. However, both the variants seem to be equally highly transmissible, and therefore the similarity between both the variants seem to be equally highly transmissible, and therefore so the challenge, therefore, that we have to deal with is that a lot of research is being done to look into the impact of this new variant, in particular the issue of to what extent is this more virulent, and there's no evidence that is more virulent. There's also no clear evidence as to what the impact would be of the vaccines, and so all of that work is underway, is being dealt with at the level of the researchers. So from that point of view, it's important just to say that there's a huge amount of experts in genomics that are doing work as a consortium across the country to deal with new information that comes from that level. I must say South Africa is working with a number of international partners as various countries that are advanced in this level. It is quite clear that we're dealing with cutting-edge technology here, so we will always know as much as anyone else in the world would know about this virus. Then it leaves us now with the one reality that is, excuse me, the reality that to deal with this issue, the only major source of protection is going to come from the vaccination program. And we believe that in South Africa, if it was possible, everyone should actually have a vaccine. But in terms of our current calculation, you need a minimum of 67 to 70% of the population to be immunized so that you can break the cycle of transmission. That is what we call the herd immunity, and that is based on a calculation that is made by scientists on the basis of the transmissibility of the virus in terms of how many people each person can be able to infect, as well as the various other factors that have got to be looked into to calculate what would be the safest number of people that would limit the spread of the infection. We then embarked on a program to collaborate with various partners in the world to look into the availability of the vaccines. And then we had agreed, at the time we started this discussion mid-year, the issue was in particular about two approaches. One approach was that we worked together on pooling the numbers of countries together to try and create a degree of safety by ensuring that we have large numbers of countries that can negotiate better prices. At the same time, we enrolled in the COVAX facility, which meant that they would be looking at about 9 vaccine candidates that would be working on to see which one would be successful. There were no results that were showing, except that everything had been done in the laboratories. So the other option was a bilateral agreement wherein countries were expected to put some contribution immediately and bind themselves to the fate of that particular vaccine, which meant that some of the amount that would be contributed would be non-refundable, but it meant we would be taking a risk on the particular vaccine, even though it would be a one-on-one. So we felt that the risk was too high between the two programs, and we felt that it was important for South Africa to work with those countries that would first find out what the most successful vaccines would be, and then we would then start following the issues from there. So we have then affiliated onto the COVAX facility, and then we committed for the payment of 10% of vaccine, which is worth 10% of the population. So there were a few delays in the payment of that vaccine. There were not, major issues that would have warranted the degree of anxiety that could have been generated when the payment process was a bit slow. So what actually happened in that case was that the Treasury had advised that what we needed to do is to raise the money so that there's no need to immediately tamper with the budget framework that had been tabled. And so we needed to look at what can be done, looking at the additional support that we got from the Solidarity Fund. And this was very helpful. And then it made the process to move fairly quickly. On the other hand, between Gavi, which is the Global Alliance on Vaccine Initiative, that Gavi was negotiating terms of the agreements. And in that process, those terms of agreement meant that there were to be guarantees. So there was quite a lot of discussion between the legal teams on both sides. That is what really caused the delay, to say what is the best way of expressing this kind of guarantee. And then between them and Treasury, it took a while to resolve that. But they had acknowledged that there was no risk to the South African participation in that process. And so that was ultimately resolved. And as we speak now, that amount of money was paid and guarantees were signed. And the amount that is guaranteed is actually in the budget, and that was sorted out between the Department of Health and the Treasury. So the issue of COVAX was actually sorted. So the President announced that, in fact, in terms of the COVAX platform, we were going to have we will have the first vaccine into the country around April, and that was the timelines that have been given to us by the COVAX facility. But by the time we got to that point, a number of results had now come out to indicate what progress we were getting in terms of the success of various vaccine candidates, and there had been a lot of announcements. On that basis, it gave us enough confidence now to be able to start engaging the various manufacturers. So there have been engagements on a bilateral basis with various manufacturers. There's been one platform. There's another platform, again, where the President Ramaphosa had created a task team which was looking at the continental access to vaccine, using the large volumes of the continent to actually leverage better prices. And so we started getting engaged in that kind of process. That process gave us a lot of insight in terms of what the various manufacturers were offering, what volumes, what quantity, what clear amongst countries, particularly those with high income countries, particularly in the West, US, the Eurozone, the UK, had actually committed funds on a risk hedge basis much earlier, a kind of luxury that South Africa was unable to afford because of our limited resources. And so they actually purchased literally each one of the several vaccine candidates long before even the results came out. Now, we were looking at that, and we were advised that, in fact, that was going to be much more riskier. But once the outcomes were beginning to come out in terms of the success of the various vaccines, we were then able to now start engaging. So we have non-disclosure agreements that were actually signed much earlier, from September, October, and so on. And these were basically to allow the manufacturers to share information with us, which would have been otherwise sensitive, which would have needed to be protected, as we're now trying to look at what the best ways of dealing with these vaccines would be. There will be a presentation that's going to take us through the kind of selection process of which vaccines we thought needed to be considered. as advised by Ministerial Advisory Committee. You will also go into a bit of detail as to what is there amongst those particular vaccines. I think as we stand at this point, a few points that I think are important to mention is that, for one, we have had lots of discussion with the Minister of Finance, basically to say that the fiscus is going to carry the major burden of having to procure the vaccines. In the process, we've also agreed that we will look at and activate other means of raising additional funds, and that is the second way would be to approach the medical schemes and ask them to make a contribution, which will also be on the basis of social solidarity, wherein they could also cross-subsidize some of the members of the public. And the third one is to get donors, business to also make their own contributions. And so these together could be work together with the Solidarity Fund. So quite a lot of mechanics of making this system to move on are in place. The Ministerial Advisory Committee has given us an outline of a framework of what we needed to do, and that will be shared as well. Amongst the issues that were important were the question of prioritization of different sectors of society, starting with the ones who are most vulnerable, and then going right through in stages to be able to ultimately reach to all the members. So we have actually engaged a number of manufacturers, and we're at a stage where our discussions are fairly sensitive, and we believe that we should be able to conclude as much as possible. We did indicate that we were pushing to get now access to some vaccines so that as early as February, we should be able to get to that point. So I want to hold that for now, just to say that we will take through the portfolio committee through the presentation, but also at the same time, it's important for us to note that there's quite a lot of anxiety in the society. It's largely because the resurgence of the COVID-19 has actually, kind of created a lot of panic with the numbers of people who are getting sick, the number of hospitals that are having, that are filling up, and the numbers of lives that we are losing. It is actually natural that we should all be anxious at this point. I'd like to just say that this situation will manage with the best of our abilities, but also we will be making sure that we bring the vaccines as quickly as possible into South Africa. By the time we start the vaccination program, we won't be very far different from many countries. We would actually be all in line with most of the countries. So we would like to assure the public that, in fact, we are all on course insofar as this matter is concerned. We have noted there's been quite a lot of comments and concerns and criticism coming from different parts on the public. We want just to acknowledge that yes, the issue has to be debated because it's a matter of public importance, but that the government has actually been on course when the matter is actually being handled. There will be vaccines available. They will be available in stages in terms of the high risk of the population. That is, we will have advised, we will go through those priority lists as we move on with the presentation. That at the end of the day, South Africa has actually, as a country, been focused on the best possible way of dealing with this COVID-19 situation. And therefore, we don't feel that the anxiety must make people feel that we have basically got ourselves into a more difficult situation than any other parts of the world. Yes, some countries have just started vaccination. We will also be starting our vaccination program soon. And so we believe that the whole of next year we'll do our best to vaccinate as many people as possible. Our target being the 40 million people that we have put on as a requirement for the herd immunity. And of course, like any other countries, there may be challenges with the logistics. Will indicate how far we've gone with that plan. I want to leave it at that for now, and then say to Honorable Chairperson, if we could allow Dr. Anban Pillay to take us through the presentation. I will come back afterwards then to make concrete to make the closing comments. And if there's anything that I need to also clarify on the presentation, I'll do so. Thank you very much for your patience, and if we could allow Dr. Anban Pillay to come on and table the presentation.
Okay. Okay. Yes, Minister, that has been extremely helpful. We will now move on to the presenter, Dr. Anban Pillay. But I think your opening remarks were quite detailed. They have been of great assistance on the matter that we're dealing with. We are beginning to formulate already our clarity-seeking questions to you, even based on what we have just said. But let us then move into the presentation as presented here. Honorable members, I've noted your raising hands, the wanting to speak, and I've noted you. Please go on our WhatsApp group and see where your name is appearing and indicate if the only person I have not indicated, I've put her there to speak, even though she didn't raise her hand, is Dr. Tembekwayo. You will also appear on the list. You can then decline when the time comes to you, but already look at your list that I've already formulated for members to ask questions. Thank you, Dr. Anban Pillay.
Well, can we ask the administrator to open up so that we can share? I can continue with that presentation. I'll make it quite brief because it sounds to me like Dr. Anban Pillay might have been having some problem. He was dealing with another sensitive matter as we were starting this discussion. So I will just table that presentation if we can be allowed to share. It said only the host can share, so I think we might all be having a challenge there. Could we be allowed to share?
Ms. Machalamba, can you assist us?
Is that visible, Chairperson?
Clearly visible, Minister. Thank you very much.
Thank you very much. Let me try and then walk through this because the understanding was that Dr. Anban Pillay would be in, but I've just got a note that there's some crisis. I think the numbers of issues that we're handling that right now. So I will just proceed. Basically, I think the first point which I want to make, if you look at the numbers as of the 6th, is 1.149 million. That was published yesterday. Then we have a case fatality of 2.7% at 31,000 individuals, with recoveries at 929. That comes to about just 83% or so. That has been an increase of late, which is indicating the severity of the second wave. The point which I think is important to watch here is that the first graph is showing on the left the first surge to June to August, which has now started again from end of October up to currently where we are. But the difference between the two is that the gray graph is showing how the Eastern Cape was the first, whereas in the previous one it was Western Cape that was the first. The Eastern Cape has already started plateauing, although we're still having a lot of reports then which we are correcting in terms of ensuring the accuracy of the fatality numbers. But nevertheless, the number of new cases is already on its downward plateauing effect, if you can see. Then the yellow line or the orange is actually the Western Cape. And again, Western Cape, what is visible is that the Western Cape, the cumulative numbers, as you can see, the 7-day moving average, is already gone to twice the height of what it was in the first stage. In other words, when you run into, when you get to the Western Cape health services, you will notice that they've run out of oxygen. They were to, do emergency support for that. It's mainly because the numbers have increased far higher than what was previously experienced. KwaZulu-Natal, exactly the same. You see the numbers there. The current trajectory is showing that it's almost twice as high as what it was before. And next to it, rising steeply, is Gauteng, which is still going to show in the next few weeks when the people return to Gauteng after holidays. So we expect that the pressure is going to be building up onto Gauteng. Already as it is, it's already 2/3 of what the height was before. So the numbers are expected to be much higher. Then the other provinces have got similar kind of experiences. As you have heard, Limpopo, Mpumalanga, they've got issues that they are managing. So this is the indication of our second stage. This graph is showing already that deaths, if you look at the red graph, the deaths are already higher than what we ever experienced before. The admissions are already higher than what we experienced before. The new cases on a 7-day average are also already higher than what we experienced before. So we have then worked on the framework for vaccine implementation. Here we're looking at some of the governance structures and the system of what you need to do. So we have to look at the governance structures. We're looking at the issue of communication and stakeholder engagement, and then the whole flow chart that's talking about prioritization of the population, allocation of vaccines, distribution, supply to point of use, administration, and then issues of safety, and following up on second dose. Then a link to that, other issues which really depend on a huge data monitoring, supply monitoring and tracking reports, and vaccine uptake, adverse effects, events following immunization. All of these are issues that you have to actually monitor with a very reliable data system. And then regulatory considerations and finance. Now, this point I'll just highlight, I've made the point already. We need to prevent morbidity and mortality and ensure that there is a protection of the entire population. That's what we call population immunity. That becomes very important. And the principles of what we need to do with the vaccines is that the government must be the sole purchaser, and that we'll be using a multiple supplier approach, where we'll be using a number of players who are going to be supplying us. But just to note that if you get one dose from one company, you must get the same dose from another, from the same company. The second dose must come from the same company. You don't mix the two doses. And that we are guided by a Ministerial Advisory Committee, and that we have to have a pre-vaccination registration, and then must be a national register and a rollout committee. This is an outline of what would be in the committee, largely departmental, but then of course you've got SALGA, you've got private sector, you'll have civil society and WHO. Then other stakeholders that will continue to guide us here. On the one side, we're going to have to be having the Ministerial Advisory Committee, and that will also continue to focus on the issues of behavioral change, issues of technical issues around vaccines, emphasis on non-pharmaceutical interventions. Then the labor, we need to work very closely, because a large number of our health workers and some of the essential workers are going to be linked to the unions, and there are issues of safety that we've been discussing with the unions. We also need civil society here. It's important that we need to have societal buy-in onto the issue of the vaccines. Then, of course, some on the private sector, we're going to be working with the private health sector, medical schemes, hospital association, private hospitals, and pharmaceutical associations, and so on. Effectively, as I said, there are three ways of how we're going to be looking at the support from the private sector, pulling off funds to support vaccination, promoting the use of vaccine amongst employees, and provision of a vaccination platform on occupational health systems. Then identification of and prioritization of target population. Here we're guided by the Ministerial Advisory Committee. We're looking at those who are most at risk, and therefore we group them up into various groups. The first group are those who are going to be in high risk, who are highly targeted, so that we need to make sure that health workers, frontline health workers, are on the first category, which is our first phase. The second phase will also extend to those with comorbidities, the old these over 60 and so on. And we will then have quite a lot of activity on the second phase that will be linked to the availability of more quantities of vaccine. And then after that, this becomes a continuous vaccination that will happen long after so that on a continuous basis, everyone else gets covered. Then when we talk about health workers, basically all the categories of health workers, even though they are seemingly categorized here, but they will all be covered. And then, of course, phase 2, we have to talk about essential workers. That covers those frontline workers, teachers, police, military, miners, and other people who are working in settings where they are serving communities. So the population exposure, the exposure to the infection because of their service to the community. So those are the groups of people. And then, of course, those with comorbidities are going to be the phase 2. Those are the with underlying illnesses, HIV, TB, diabetes, and so on. Then there are a few issues which we're still resolving on the issue of vaccines. Pregnant women, we will not immediately include them until we've got the issue of safety properly indicated there. Then the other issue that we still want to get a bit more clarity on are the people who have been already previously infected. Do they get the antibodies? So that issue is being worked on, so we'll get proper advice. Then what do we look for on the vaccine? And this is how we've been guided. So just to decide whether the vaccine, because we had 200 candidate vaccines, so the ones that you are going to talk about are those where there's safety issues, efficacy issues, and immunogenicity has been well established. In this case, about 11 of them have got that kind of situation. So we can now start talking about all of that. Then secondly, we have to look at the supply. So for example, if someone has got a very good, there's got high efficiency, high efficacy vaccine, and it's safe and everything, but then it's too expensive, it might be an issue. But maybe it might be if the vaccine is good, but they are so booked, they're overbooked that they don't have vaccines available until 2022. Obviously, we can't deal with those. We have to look at others. So that's what is involved in all the negotiation. So we have to start looking at the ease of use, stability during the storage. All of those issues become important. Then the issue of cost and registration are part of what has to be looked at. So the number of vaccines that we're looking at. So for example, we've looked at the Pfizer. In this case, they've already been registered, high efficacy, and then there are storage issues that we have to look at. Then the AstraZeneca is the other one that has also got some approval in some of the jurisdictions, very efficient, and both of these have got 2 dosages. And so the other one is Johnson & Johnson. Part of it is also being prepared in South Africa between Johnson & Johnson and Aspen. And so again, they are working on regulatory approval. And so we believe that we need to focus on this because it's very promising. Then we've got Moderna, which is already being used in the US, which we are looking at. Then there's also Sinopharm in China. And all of these are actually very high efficiency vaccines. And all of these now are what we've been looking at together with our Ministerial Advisory Committee. So we have to make sure that the issues of safety are attended to. On regulatory matters, they have to look at where they are registered and that they have submitted the necessary documentation. The process has to be done properly. But what we are having is that the SAPRA has got a special task team that is facilitating the registration of vaccines. They can also do authorizations in terms of Section 21, where manufacturers have not submitted dossiers. And if we think that all the evidence is pointing at the very useful vaccine, that can actually be also taken into account. So we have noted as well that there has to be, because of the new technology that's not been seen before, there has to be quite a degree of active and passive surveillance, which we're going to have to work together between the department, WHO and SAPRA, just to make sure that everyone who's got a vaccine must have a kind of like a yellow card vaccine card system, which you keep, that always shows that you've actually had the vaccine, and the 2 doses will be recorded there and their dates of administration and so on. They also have to run what is called Med Safety app, which is to look at people with adverse effects following vaccine immunization. It's also important to make sure that we monitor because the development of the vaccine has taken place over a very short space of time. Then we're looking at various ways of distribution mechanism, and here we have to either look at central distributor, where we receive from the manufacturer to a central distribution, or you've got a situation where you've got a mixture with central distribution and contracted distributors, or you've got a situation where the manufacturers are contracted directly as distributors, or we have the supplier-distributor situation. That will then cover on the right public hospitals, vaccination centers, mobile clinics, private hospitals, pharmacists, and so on. So that is being worked on now so that we can clarify we can refine the process as we move on. Then the issues of security, distribution security, vehicles must be tracked, and all of that, simple basic issues of making sure that you don't have excuse me, you don't have a problem of tracking where the delivery, the stock is. And then, of course, the issues of tracking and tracing of vaccines with barcodes, so you know who got from which particular bottle, which particular batch it came from, and all of that. Safe disposal of a vaccine is going to be an issue. Verification of distributed volumes and what's been distributed, what's been administered. We need a whole lot of systems to deal with that, including the issues of monitoring wastage. So there will be a number of programs here. Some in the phase 1 group will be having people will be vaccinated from hospitals, where staff can be just approached in the hospitals. And there's a whole lot of issues there because the slides have been distributed. I won't waste time. Then the other outreach programs where we will actually have a team that goes out. We call that hub and spoke model. So you get one hospital, and then it rounds up all the clinics and the centers where health workers are, so that in that particular district everyone is covered. So that's another way of looking at it. Then there are also vaccination centers. This works well in the urban centers. We've seen that happening in Europe, where they put up a center in a city because of the proximity within suburban areas, makes it easy to access health workers that are needed, so they can actually move to that center and get vaccinated, and that should be it. So that is another way of, so those are the different formats of how this is going to be dealt with. And then it's just the distribution within the health workers, so that where do you find EMS staff, where do you find health workers, community health workers, and so on. Then the other delivery platforms that have to be considered are pharmacies, mass vaccination centers, and then community halls, churches, and so on. So all of these, as you go on with phase 2 and 3, we're going to be considering a wider range of mechanisms. Now, this these are indicative figures of what it would mean. For example, if you did 40 million people over 12 months, it's a huge task, and it means we'll have to really target huge numbers, 316 per day, and so on. When the machinery is working very well, it should be able to move up to that level where each vaccinator can vaccinate 50 people per day. It's going to be quite a huge run. We're targeting about 6,300 people, and drawn from clinical associate, community service, doctors and nurses, contract nurses who are involved in other programs in vaccination, etc. So we're looking at targeting those people. For every province, we need each one to appoint someone who's going to deal with the cold chain management, and so that's the other issue. Then we have to deal with the integrity of the whole process to ensure that vaccine confidence increases because of transparency and the effective management of safety issues, and also ensuring that the reporting of any side effects that are detected. And I indicated the yellow card system, and I also indicated the safety issues. Those are going to be all have to be built into the system. The issue of training is going to be important. Our partners, civil society, business unions, all of them that have to be part of our communication system so that they can talk to the members out there and talk to the public. It's important to align the messaging. Right now, we've got everyone saying different things. It's important that we must actually send one message so that we are able to get everyone to understand what exactly the program is all about. So there's additional work that has to be done, development of materials and all the other issues that are indicated there. And so the need for a very strong electronic vaccination data system, which is national and centralized, so that you can always find. You want to know if Zweli Mkhize was vaccinated, you must go and check somewhere. Maybe they lost their card and you want to now redo their card before they travel, so you can be able to do that. And so there's quite a bit of tracking of specific issues, the identity of the individual, who's the manufacturer, what's the batch number, what clinic administered this. All of that information needs to be dealt with. And so there has to be a link between NHLS and NICD. The issues of consents, for example, if someone says, I don't want the vaccine, if someone has to do the vaccine, they've got to sign somewhere as a kind of consent. And so all of those issues are being taken into consideration. Then you must have a dashboard that's able to monitor. If you want to know every day how many people are vaccinated, you must be able to find all of that. So all of that information needs to be kind of recorded somewhere. Then there are responsibilities for the National Department of Health, which basically are around finalizing the model and establishing coordinating committees and also supporting the provinces. The same thing with the provinces, they've got to also do a similar arrangement where they've got to also go procure needles, swabs and everything, so that when all of this thing is put into operation, we can start the process. This kind of work here is a kind of work where you do the plan, that's one thing. But to actually make it work, it can only be proven once you've started to administer. Then you know what are the weaknesses in the system, and then you can strengthen it at that point. So we don't expect that everything is going to be perfect as we start. We believe that things are going to be strengthened as we go and we learn from the system. When we started the engagement much earlier, we're then trying to look at what could be the indicative figures. These figures are not really accurate, but they were figures that were based on just a kind of modeling process, just to say what could it be. So, for example, if you were to take 5% of the one and 5% of the other and so on, I'm just giving you this as an example. This is not how it's going to ultimately pan out, but just to give you a sense as to, at the start, when the results came out, what were we looking at? So we then use that to guide what the quantum of resources that might be required here. So it doesn't say this is a budget. It says to us we have a sense as to where the cost is going to ultimately lie. So let me leave it at that with this issue, and then just make one or two other points. And the first point which I want to make is the fact that the Treasury has allocated amounts. It's not fixed at this moment, but they have come to the party to say they are working with health to make sure that health requirements for funding will be covered, and health is going to be dealing with all the logistics, the procurements, and so on. We're going to have a special kind of dispensation that's going to allow a deviation so that different manufacturers can be engaged, as we already currently are engaging them. There's quite a lot of discussion that is going on between the department and the various players to be able to get to a point where we can say we've got our orders confirmed, and so Treasury will be allowing the process so that there is no difficulty with the procurement processes, that you can speedily procure and purchase and pay and get receipt of the of the particular vaccines at a particular point. If I can just hold it at that, Chairperson, I'm sure there are many issues that I have left out, but the members might want to raise those, and then I'll try and deal with them as they come. Thank you very much. At this point, I'd like to hand over back to you, Chairperson. Thank you.
Okay, thank you very much, Minister Mkhize. Mkhize, you must have a big glass of water next to you. You made very detailed opening remarks, and we have now presented to us, and there are honorable members who would like to ask questions. Honorable members, may I request you, because these issues of critical importance, there are recordings that we are taking. We like to see and know who's talking. That is what the parliamentary staff has advised me. Number two, we are very welcoming to the media. This meeting has got 76 participants. And of course, we are just 11 of us in the portfolio committee. And there's 4 leaders from the Department of Health, including the Minister. There's going to be about 6 parliamentary staff supporters. So there's been a huge interest on the media, and so this matter is at that level, Honorable Members. I'm just informing you. Please switch on your camera at the time that you are speaking. I'm going to read the first 6 names of the members who will speak in this order. The first one is Honorable Jacobs. The second one, Honorable Wilson. Third, Honorable Kwahube. Fourth, Honorable Ismail. Fifth, Honorable Van Staden. And sixth, Honorable Chirwa for the start. We'll take the other 6 after these 6. Please, honorable members, if I could, to save time, let me not come in between the 6 of you. If there's a pause of more than 30 seconds, I'll take it that you are struggling wherever you are, and then we'll move over to the next speaker. But if these 6 honorable members can speak one after the other, Jacobs, Wilson, Kwahube, Ismail, Van Staden, and Chirwa, then I'll come with the other 6 thereafter. Start, Honorable Jacobs.
Thank you, Chairperson. Thank you, Minister, for the presentation. Happy New Year to everyone present here today. And I think it's a very good time for us to have this portfolio committee meeting. Very early in the year, I also want to congratulate our members who were willing to participate in a meeting outside of parliamentary time. So, and also, thank you very much, Chair, for the honors given to Member Pumza Janchi. I have 5 points I want to speak on. The first one is on the letter of the House Chairperson, but we want to thank him for the letter. We also want to note what was put in the letter, and we also appreciate, Chair, the answer that you had given with respect to our role as an oversight committee. And yeah, I'm speaking of the request of an ad hoc committee to have been formed at Parliament. I think it wouldn't do justice to ourselves for us not to fulfill our mandate. And our mandate specifically is to have oversight over processes and procedures. And we appreciate the input from the House Chair that we will accept, and we will perform our role as oversight committee over the COVID vaccine rollout. On the second part is from the letter from the Chief Whip of the EFF. We accept your explanations. We know the content, and we know the request of the letter. We thank you for your explanations, and we also understand the explanation as given by the Minister on the bereavement of Minister Tito Mboweni. My third point is on slide 3. If you would notice, there's been a great increase and progressive increase in the number of infections, and the rate of transmission is higher now with this new variant. However, I'm very concerned about the discrepancy between the number of infections and the fatality rate. as shown in slide 3, for especially between the provinces. If you look at the number of infections in Gauteng being at 304,442, with a fatality rate of 1.9%, and the Western Cape at 223,888 and a fatality rate of 4%. It tends to make one very worried about this when you see this difference. But then I also noticed in 2 other provinces there are high fatality rates. For example, in the Eastern Cape at 4.7% and the Free State at 3.4%. And that begs the question, what would be the contributing factors? And I'm raising this with the Minister. What would be the contributing factors which would make us have such great variance, some provinces at 1.2% and some up to 4.7%. But in terms of the numbers, Gauteng with its big numbers having a lower fatality rate. Now, I've noted what the Minister raised in terms of the number of beds, the number of increased admissions, the increase in the new cases, the difficulty and challenges with oxygen and staff, etc. But really, we need to address this. And this takes me to my next point, that as much as we are waiting on the vaccines, and we understand that this situation of the vaccines resides with the NDOH and it resides with the ministry, and while they are doing this work on acquiring the vaccines and working on the rollout plans and us doing our oversight over that, there is something immediate that needs attention, and that is the clinical situation. Our clinical situation in terms of are we providing the necessary treatment to all of our patients in order to increase the survival rate. And that to me is a very, very worrisome thing when I look at the number of deaths and you look at the graph, where there's an escalation and a growth, which up to 6th of February, which was yesterday, 6th of January, which was yesterday, we saw that increase in spike in the number of deaths. And obviously it goes along with the number of infections. And we've already spoken to the transmission rate of the infection in terms of the new variant. Because the other challenge that we will face later is that increase in the number of chronic people with chronic diseases post-COVID infection. And we need to be able to stave that off or prevent that from happening. For example, lung challenges, challenges with lungs, etc. On the vaccines, thank you for the work that has been done to here and the progress that has been made. I am concerned about the many myths and the wrong messages out there. Now we need a program to be able to answer those and address those points. We only need to look at the eradication, and this is our general public. The eradication of smallpox in the world. Now, smallpox was emaciating the population in the late 1700s. It was a huge problem in the world, and in 1796, the very first vaccine that was formulated was to be used against contagious diseases was that for smallpox, and the world has been able to eradicate smallpox in the same way we can speak about polio, measles, BCGs for TB, etc. Therefore, I think we need to ensure that we get the right message out there, that we demystify this. And I think the role of the media, them being present here today, is important to put out the right message, that the vaccine is important, it is needed, and that they shouldn't be spreading some of the myths and the wrong statements which are put out there. And I'm giving the example of smallpox. We also noted in terms of the vaccine, the press statement released by the Premier of the Western Cape, who said that they would procure the vaccine as a province. Now, we know that this is a program that is rolled out by our National Department of Health, aligned with the ministry, and I would like the minister maybe to speak on that issue when there's a direct opposition to what has been put out, having listened to the minister on television the other day, that there's going to be a national procurement process. And then finally, Chair, I think we need to continue with our message of preventative measures. On the one hand, I'm talking about the clinical treatment and being able to save lives. And on the other hand, our public has a responsibility to save lives themselves and save their own lives. And I think we're faltering a little bit on the message of the non-pharmaceutical intervention. And getting that message out there again. Stay at home, social distance, wear your mask, wash your hands with soap and water preferably, sanitize with the sanitizer if you don't have, and follow the rules and abide by the rules and regulations of our country. Thank you, Chairperson.
Thank you very much, Chairperson. From the outset, may I just, on behalf of everybody and certainly on behalf of myself, offer my sincere condolences to the family of Dr. Dianti. I think it was a big shock to all of us. She has been a long time serving member of this portfolio committee. She was very dedicated, and I think it was a very, very sad loss, and I think it hit all of us quite hard. Also, my condolences to our chairperson, who we know lost his brother recently as a result of COVID. And I think we are at the stage now where each and every one of us, if it's not family of ours, somebody close to us, have been affected by COVID and have lost people. So we uplift all of those people in our prayers, as well as the country as we are going through this torrid time with this pandemic. Yes, we're at the start of the new year, and while one wants to say Happy New Year, it doesn't feel so good when we get a report of almost 22,000 cases, new cases being reported on yesterday, which is hugely disturbing and doesn't make for great feelings. I want to deal with some issues specifically. First of all, the letter that we received from the Honourable Frolick, from the Speaker's office with regards to the fact that there will not be a special sitting to discuss this issue. I still believe that that is necessary, and that this must come back to the Portfolio Committee. Well, we have been asking for a meeting with the Portfolio Committee for over 2 weeks. We have been desperately disturbed about the situation. We have not been given access to information unless that comes via the media, which is not always reliable. We have not been given access to continual information. And there has been a call for unity. Well, we cannot have a unity if we are not all participating, if we are not all on the same page. The first outbreak of COVID, there was regular meetings with all the parties with regards to the situation, what was happening, what was being done, what was necessary, and everyone was given an opportunity to participate. That has stopped, and I don't know why. We must understand that no information leads to misinformation and fake news, and this is what we're having to deal with at the moment. Now, we are members of this Portfolio Committee. We are there to hold the department and the ministers to account. We are elected officials representing the people of this country. And they are coming to us for answers. They are coming to us for clarity. They are coming to us to find out whether news is fake or whether it's not. And it's very, very frustrating for us who are supposed to be holding people to account and who are elected by people and find ourselves in a position that we're totally unable to respond, or we're not sure ourselves. It does not create a good impression, and not on this Portfolio Committee, not on the ministry, or us as the elected officials. And it really makes me very angry that it's only when we get a letter from the Speaker saying that this must be taken up by the Portfolio Committee that we actually get a meeting held, when we've been asking for this meeting for weeks. I think it showed a lot of disrespect to us, and it's been unacceptable. I want to deal particularly today also, I am a member of the National EMFs group, the Emergency Services group, which is both the fire brigades and all the ambulance teams. We today are advised by the EMS groups that 50% of their calls at the moment are all COVID related. Now we sit with the situation, and I have just been down to the Provincial hospital here, the Netcare hospital here in Polokwane this morning. There is a queue of 29 ambulances waiting to get access into that hospital. Some of them have been sitting there for 2 to 3 hours already. Now, when we have all of our ambulances sitting outside hospitals, waiting to get patients who are very ill in those ambulances and who are requiring life support, and we can't get them into the hospitals, those ambulances are unable to go out on other calls and to help and rescue and support other people. This has become a huge crisis. They are also reporting running out of oxygen. So our EMS system is severely under strain. Outside our Mediclinic and the Provincial Netcare hospital, tents have been erected. Now the public in and around places like Limpopo, and it's not just in Polokwane that we're seeing this the country over. We are even receiving videos of ambulances arriving at underground garages at hospitals, and beds have been set up to admit people there. And then we hear from the provinces that there's no crisis. There is a crisis. There is a crisis. Dr. Jacobs talked now about deaths. Yes, the deaths are astronomically high. But there are people who are dying who shouldn't be dying. And I'm not talking about COVID. I'm talking about people, stroke victims, heart attack victims, people who've got serious ailments, who are being taken to hospitals, who cannot be admitted, who are being referred to another hospital 200-300 kilometers away and dying en route because they couldn't be admitted into a hospital under emergency circumstances. That is just, it's unacceptable. It's unacceptable. These are issues that really need to be dealt with. Now, I'm not sure about other members of the committee, but I know that several of us have been trying to get hold of the Medical Research Council, the Minister's Office, the Deputy Minister's Office, SAPRA, all of these entities that fall under our department to get information. We cannot get hold of anybody. Not the Minister's Office, not SAPRA, not the Research Council, nobody. Nobody has been available to us to give us information and to correct the fake news that we've got. Now, of course, there is going to be panic because the panic is created by the lack of information, and it's very concerning. And then finally, Minister, if you could give us some clarity now on what is happening at the border posts. The border posts, and we've received videos of what is happening at Beitbridge, and while my heart aches for those poor Zimbabweans who are trying to escape the torrid situation in their own country, we're receiving videos of thousands. Literally thousands of people trying to get back into South Africa, a lot of them not wearing masks, who are climbing over fences, climbing over each other to get into the country. That's an issue straight away, because what are we doing at those border posts to test these people? But secondly, there are border posts like Beitbridge and Eswatini and Mozambique where people come in regularly on business and to get children to and from schools. Now, initially, the time they were allowed to get a 14-day, they were tested that was valid for 14 days so that they could come and go quite regularly to get children to school, to get children back from schools. And now the new regulation is only 72 hours. This has caused a backlog of up to 15 kilometers of people waiting to get children back to schools, universities, colleges, and things that are open. And while that is happening, all of these thousands of people are milling around and infecting each other all over again prior to their entrance into this country. Can we please get some clarity on that? And I know that and obviously we want to know on the update of the oxygen supplies in this country, because oxygen, particularly from the EMS groups, are advising us all the time that there is a shortage of oxygen. Is there or is there not? I know that my colleagues have a lot of other questions, so I will leave it there. Thank you, Chairperson.
Good morning, colleagues. Thank you very much, Minister, for the presentation. I'm going to run through my 4 key questions quite quickly. I think my colleagues have covered the other matters that the chairperson had spoken about earlier. I just think before I get started, I just think it's very important to get this view out of the way, that we've had this conversation about the role of Parliament during a crisis or the role of Parliament during a pandemic. We had this whole conversation at the beginning of the year when we were first dealing with the pandemic. And it's very important to then, make this call again, that Parliament is not simply just the annoying stakeholder that has to often, be onboarded after the fact. It is a partner in this process, and it needs to be treated as such. And so I think I would make the call, and I would make the call, chairperson, that we actually have to formalize the updating of this portfolio committee on a regular basis. We've got to formalize it, whether it is once a week or once every 2 weeks. The reality is that we cannot be following the updates of what is going on, whether it's about vaccines or about infections or fatalities or some of the problems that we are seeing across the country. We cannot simply be following those from television stations without understanding exactly where this is coming from and getting the relevant questions. And so this is not something that is necessarily directed at the Minister of Health, because he reports to the portfolio committee. And so I think this is something that is directed to my colleagues, that this is a very important role for us, and we've got to take it seriously. We are not just a bystander in this crisis, but we're an actor on behalf of the people of South Africa. And if we don't take it seriously, then it's an indictment on all of us as members who are elected to serve. Then, Minister, I've got critical questions that I would like to pose at you. By your own admission, you have stated that South Africa was gun-shy of starting bilateral negotiations with vaccine manufacturers, and that, in fact, you most certainly almost relied solely on the COVAX facility for a long time, while other countries across the world were already starting to make negotiations with vaccine manufacturers, and we hadn't started that process because of the risk that you had outlined. And so, again, like I said, it's clear that South Africa was reluctant to get started on this. And often people say the reality is that it was financial problems or whatever the case may be. Now, I want to know 2 things. One, when did the bilateral engagement start? But not just broadly speaking, Minister, because every single time you are pressed on specifics about these bilateral engagements, you often refer to saying, these are sensitive negotiations, we've signed NDAs, we can't actually really divulge some of this information. And now this is, to your own admission, also fueling the kind of anxiety that we're seeing across the country, because we've got a situation where the COVAX facility can only deliver in the second quarter of the year. And you are hopeful that you'll be able to secure some kind of vaccine for our frontline workers by February, but you aren't able to divulge some kind of concrete timelines, or at the very least, when those negotiations started. And when are we talking? Well, are we already at a stage where we're talking acquisition? Are we already at the stage where we're talking, the procurement of a vaccine? It's unclear, because you've got 5 or 9 of these manufacturers, and it's still unclear where you are. Have you dwindled it down? Have you taken out the manufacturers that are not suitable for South Africa? Have you looked at whether or not some of them are not even worthy of looking into? Have you also looked at whether some of them are prepared to do business with us? It's simply not good enough, sir, for us to accept that these are sensitive negotiations and we will come back to you when the time is right. We need some kind of determination of where we are. The second thing is, the money is often mentioned as a hindrance to some of these vaccines. We saw or the vaccine acquisition. We saw last week reports surfacing that there were, the South African government has said some of the vaccines that are on offer on the market are simply unaffordable to us. Now, again, I mean, if we are not having proper conversations about what else is on offer, when can those be delivered, we can't make an objective decision on whether or not some of these options are way too expensive. But more critically, sir, the problem here is that also, surely South Africa's entire priority should be targeting at ensuring that we acquire a vaccine so that we may be able to get back to some semblance of normality, so we can save lives and we can save livelihoods. It makes no sense to me how the South African government can in any way be considering any kind of priorities like bailing out failing state-owned enterprises when we can be redirecting billions of public money into this purpose. And so it almost feels to me that this is one of those moments where it is a life or death situation, and we cannot be talking about what's affordable and what's not affordable when there are superfluous priorities that the South African government has. So if you can just make mention of that process and why certain ones have been negated and why certain ones have been entertained. Then I want to ask, just before I close, the issue around central procurement. Again, what is the wisdom around having a system of central procurement when the process can end up being sluggish, the process can end up being slow, and we will not be opening up ways for other people to get involved in the process so that we can be able to roll out the vaccine as quickly as possible. In some instances, what other countries have done is they've allowed for various negotiations, but at the same time, or if, for instance, the private sector or various provinces have decided to not only be bound by the central procurement, what then you can say is that here's a priority list which has been agreed to by the World Health Organization, which says these are the top priorities. That way you are able to target people as quickly as possible across the country, because the task of 40 million people, when our only experience of mass vaccination has been 1 million people, is an audacious one. And now what we are expecting is government to be able to handle central procurement and the distribution of vaccinations purely by itself for 40 million people within a space of 12 months. It almost seems impractical to me, which links me to my last question. COVAX has made it clear that there are two main issues that they will consider when it comes to giving out of vaccines to countries. The other one is regulatory approval, which you've stated that SAPRA is on board and ready to expedite the issue. But also country readiness. That then means that there is now obviously an incredibly important task at hand of ensuring that the task that we have at hand of 40 million people to be vaccinated by the end of the year, we are able to deliver against that. But there's other issues of logistics around transportation, around storage, around distribution and allocation of the vaccine. And so that is why we've been repeatedly calling for a comprehensive plan that is codified, that can be shared publicly, that says, this is the South African plan for the vaccine, this is how we intend on rolling it out. Because surely if you have to submit that to COVAX, you can also make that public to the South Africans. And so that's it from my side. Thank you.
Good morning, everybody. I just have a few questions. Firstly, thanks for the presentation. My first question is on the issue of the various views on ivermectin. So I read a report recently where the World Health Organization sponsored a preliminary review indicating ivermectin effectiveness. So the report specified that the trials indicated 83% reduction in COVID mortality. Now we've been told that SAPRA has done all the investigations and so forth, and they are refusing ivermectin. From my side, I would just like to know, has SAPRA done enough? If the World Health Organization has provided a preliminary review, why is SAPRA not taking this into account? Secondly, is that has the department done any comparison in cost factors with regard to getting the vaccine? I'm talking about European countries as well as developing countries. It's not really specified on your presentation. The other point is a follow-up of what the previous speaker spoke about with regard to central procurement. Now we know that Discovery is the country's largest private medical scheme and has reportedly secured and ring-fenced funding for the vaccinations of 2 million of its members. However, it cannot choose to purchase suitable vaccines because government will not allow this. Please, Minister, can you explain the reasoning why does government want to be the sole purchaser of this vaccine, considering the fact that, we need to have all hands on deck in assisting in getting this vaccine out to the people? And why don't we use these schemes, these medical aid schemes that can really assist government in locating this vaccine? The other point that I want you to know is that will the vaccinations in the long run be mandatory? And, just the reasoning behind it. I know the minister said right now that there are still, thoughts and discussions around it, but I would just like to know more about it. The issue of shortage of doctors, which we are having throughout, whether the COVID virus or not. But reality is that right now our hospitals and our health facilities are short-staffed. Can we get a guideline from the minister if all our interns have been placed? I know last year when we asked the question, we were told that by January, all our interns would be placed, and I just would like to know if that has been done. Minister, the issue of children under 18 years of age. I see your presentation specifies 18 years and over, but I'm just asking the question with relative to critically ill children that may be, needing this vaccine quicker rather than later. Will they be prioritized? The last question of mine, Minister, is that we've already had reports of corruption when it comes to, or allegations of corruption when it comes to the allocation of funds in Gauteng, to our hospitals. I wanted to just know that, can you give us a full report, actually maybe on all provinces, whether we can get a full report on, whether we have enough beds, staff, equipment, and oxygen, considering the upsurge of COVID cases. Thank you.
Thank you, Honourable Chairperson. Good morning to the Honourable Minister, the Honourable Members. It's good to see the new year. Let's pray that God will protect us during this coming year and during this whole pandemic. From the side of the Freedom Front Plus, our condolences to the family of our colleague who passed away over the festive season, and also to the Chairperson for family member lost due to COVID-19. May God protect us all. Honourable Chairperson, Minister, please bear with me because I have a lot of points that I want to raise and to need to be discussed today. The Portfolio Committee on Health, Honourable Chairperson, Minister, and Honourable Members must be involved in decisions taken by the Minister before it's been taken to the Command Council. We as a committee must hold the Minister accountable to any actions or decisions that the Minister is making. Now, we need held the Minister accountable and responsible for actions taken. Now, the Freedom Front Plus is concerned about the possible chaos that, according to media reports, may ensue in the medical sector regarding South Africa's plans to vaccinate against the virus. Now, it seems like a trust gap seems to be building between the government and several of the country's best-known experts in disease management. And in an open letter to government by these experts, which was published in the media yesterday, comes very close to saying that government is first of all lying about any plans or strategy to vaccinate South Africans against the virus. And secondly, they say a cover-up is underway to cover up a breach of duty that could cost thousands of lives. This was reported in the media yesterday. Now, this letter was signed by Dr. Dessou, Professor Ray, Professor Richards, Professor Mendelson, Dr. Abdullah, Professor Vetter, Professor McIntyre, Dr. Wilson, and Professor van der Neever. Now, this is the last thing Africa needs at this stage, and it must be avoided at all costs for the sake of saving human lives and South Africa's future in general. At present, there are serious gaps in communication from the ministry side, and this committee must be consulted before taking drastic decisions. Doing so will ensure that the correct information regarding the procurement of a vaccine against COVID-19 and the current state of affairs in hospitals and healthcare workers in the country will be conveyed to Africans. Now, at this stage, there are too many rumors about what mentioned issues doing the rounds on social platforms and causing panic among South Africans. And the only way to remedy this is to clearly communicate the correct first-hand information. Now, this committee must be kept up to date about the current state of affairs at all times so that we as members of Parliament can effectively fulfill our oversight role. But at the moment, we are in the dark regarding various aspects. And that's why we as certain members of this committee have asked numerous times this past week for this meeting today to be scheduled. And I'm glad that this meeting is happening today. Honourable Minister, we need a report on the number of patients that is currently in intensive care and high care in state and private hospitals throughout the country. The last report we received on this matter was, I think, in May 2020. We also have a report on the current situation regarding oxygen availability in state and private hospitals, as well as a report on personal protective equipment for doctors, nurses, and healthcare workers in hospitals. We are now in a second wave of the pandemic. We need to be updated regularly with such reports. Honourable Minister, I want you please to explain why South African state hospitals is still not ready for second wave, despite day 287 of lockdowns with regulations still in place which don't make sense at all. And if you want later on, I can give you some examples why I say the regulation is not making sense at all. Honourable Minister, please explain to us the placement problems with interns and how it will be urgently resolved so that these interns can help with COVID patients in our hospitals. I also want to know from the Honourable Minister, when will the Minister call upon riot physicians to come and help current doctors and nurses against COVID-19, as he has gazetted in Gazette number 43533 on 17 July 2020 under Regulation 79641. There are questions around the variant of the virus as well. Some scientists say the vaccine will not help against the new variant, and others say it will. Can the Honourable Minister please update us who is now correct and who is not, and what is correct and what is not correct? At this stage, there is little confidence in a vaccine program, as reported in News 24 yesterday. And under the heading said, a cancelled meeting delays and secrecy inside South Africa efforts to procure COVID-19 vaccine doses. Now, I just want to quote you a few. It says, documents seen by News 24 and interviews with several leading scientific experts and industry insiders confirm criticism that South Africa delayed in initiating discussions with pharmaceutical companies over COVID-19 vaccines. Health Department officials cancelled at least one meeting with one company that had reached out to the government weeks before. The Deputy Director General for Health, Dr. Alban Pillay, confirmed bilateral discussions with SARS started in September, months after many countries had already concluded deals on this matter. And just Health Minister Zweli Mkhize on Sunday denied there had been an undue delay in securing bilateral agreements with pharmaceutical companies during a press briefing in which he provided details of the country's vaccine rollout strategy. And in an interview with Cape Talk on Monday, Pillay, who was part of the briefing team on Sunday, said bilateral discussions had started in September and he hoped to finalize agreements early this month. The department was asked to confirm the exact dates of the first meetings with pharmaceutical companies, but didn't respond. Can the Honourable Minister please confirm to us today in this committee, to us as members of this committee, the exact dates of the first meetings with pharmaceutical companies and why department officials cancelled the one meeting with the one company that had reached out to the government? Why must the government be the sole purchaser also of the vaccines? I mean, and you can understand this, but there was so much corruption during COVID-19 last year, the public cannot trust the government, and how will the minister ensure that money raised or paid for vaccines by the private sector and paid out of the government, as you will be the sole purchaser, will not be stolen by corrupt official politicians? What guarantee can the minister give South Africans today that this will not happen? I almost finished, Honourable. The minister, with due respect, must stop taking action against countries that acted in time to obtain the vaccine. Stop complaining in the media that other countries must not have vaccines for themselves, as that they must share vaccines with South Africa. The fact of the matter is that while this government were wasting by making useless and senseless regulations during lockdown level 5, and instead of getting the health sector ready for this pandemic, the rest of the world jumped in with full force to get the vaccine ready for their citizens. The rest of the world did not waste any time, but this government did. Precious time and money were lost and stolen due to COVID corruption that could have been used to pay for the vaccine. Now, Professor Mkhize said that the government's plan to vaccinate 40 million people by the end of 2021 will not happen. According to Professor Mkhize, the plan is nothing more than wishful thinking. Now, may I remind you that Professor Mkhize is a scientist, and according to him, even if government at the end of April with vaccinations will have to vaccinate around 150,000 people, and your numbers today indicate this morning a huge number of 360,000 people per day for 7 days a week for the rest of the year to reach 40 million people. Now, if COVID-19 tests could not be done since March 2020 to all 60 million South Africans, according to your report of last night, only 7 tests have been conducted so far. So, Honourable Minister, how are this government planning to vaccinate 40 million people at the end of this year? And can the Minister please explain it to us? Now, the Institute of Race Relations are on their way to court if a minister does not answer questions on how the minister is to distribute vaccine. I think it is important not only for the IRR, but also for the sake of all South Africans to know exactly when South Africa will receive the vaccine, how it will be distributed, and who will receive this vaccine. And can the Honourable Minister please answer these questions today? The Minister must also explain to us the current situation regarding field hospitals, and I have warned last year that these hospitals, the few that existed at that time, must not be demolished, rather being kept for a second or third wave. Now it was being demolished, most of them. Now the question is, how much will it cost to erect these hospitals again, and why was it demolished in the first place? Thank you very much, Honourable Chairperson, and thank you very much, Honourable Minister. I'm waiting for answers. Thank you very much.
Thank you, Chairperson of the Portfolio Committee. Thank you to the Minister of Health for the presentation. First, I'd like to send my sincerest condolences. May all of you be deeply comforted during this hard time. Firstly, Minister, some of the reasons why sent the letter is because the capacity as the Minister of Health. Speaking, for instance, how much money do we have vaccines? How much money we need to ensure that the target that you have set.
Sorry, Chair, we can't hear the Honourable Chirwa.
Reached. And thirdly, where will the money, which was
Honourable Chirwa, hello, Honourable Chirwa. I was thinking it's only my line that is got a challenge with the connection. Even though I requested that we show the video and the voice, maybe we will err on the side of just showing your voice, getting your voice, and maybe switch off the camera now, because we do not get
actually paid late. Came from the primary focal point, because then, am I audible now? Yes, Chairperson.
I was saying, because we are experiencing a challenge with your input.
I believe I'm more audible now.
Excellent. We appreciate that. Thank you.
Okay, just to fill you in on what I said before. My question is that since the Finance has not attended this meeting, it is then primary to ask the Portfolio Committee to ensure that we have a meeting with the Minister of Finance as well, because some of these questions cannot be answered by the Minister of Health in his capacity, especially because we have come to learn that the primary fundamental issue in securing a vaccine for South Africans, for this country, is the issue of money and is monetary based. Over 33 countries around the world have already secured vaccines for their citizens. And South Africa, being amongst the top 15 of countries with the most infections, has not secured a vaccine for their citizens and been rolled out as of December. Now, Minister, if there is no specific vaccine that has been identified by the department, as you state that it has not been identified, how then are we already allocated a vaccine in February? How then, on what basis are we creating a rollout strategy if it is not clear which vaccine we're already getting, and if we have not identified a vaccine as yet? And from whom or which manufacturer have we been allocated a vaccine for February already, which is next month? In a few days, this vaccine is supposed to roll out. How then is this going to be the case if we have not identified a vaccine that will be rolling out in the country as of February? And secondly, what then becomes the role of provinces in distribution of vaccines? I'm asking this because the issue of information is one that is recurring and is becoming a trend, really. For instance, the deaths that are recorded for Eastern Cape that has been mentioned last night, there was a note that states that some of them was a reconciliation from May and November. This is in 2020. So the issue of information and accuracy of information comes up once again, even though we had asked this as a committee as soon as February in the year 2020. And then this, we were affirmed and confirmed by the minister that the information that is brought out to the public is accurate. And yet in the year 2021, we learned that there is still a backlog of reconciled provinces like the Eastern Cape, the backlogs. And the backlog we have in certain provinces, and our strategy in rolling out the vaccination, because it means we do not have a clear picture if there is still a backlog to date on deaths that have happened, on infections that have happened, and recoveries that are happening. And thirdly, there is an insistence to pressure the public and citizens on what seems to be the problem of government. We can't consistently preach the message of sanitize, mask, and even if we do, government must shy away from insinuating that that is the primary objective of the state. Your objective as a minister, your objective as the president, as President Cyril Ramaphosa and the Minister of Finance, is to ensure that we have a vaccine. You have not done that, which means even though the majority of South Africans are adhering to their side of their obligations, you as a state, as a government, are not pulling up your socks and ensuring that your duty is done efficiently and sufficiently, because even namhlanje, we have an issue of accountability. The Department of Health nationally is regressing. The AG confirmed this quite a numerous times, and we've raised this quite a numerous times. There's a consistent regression in the National Department of Health. Who then accounts for that? You come in and out and give us information on ventilators and beds, and even inform the Council for COVID-19 that they can lower the restrictions and the lockdown regulations because health facilities are ready, only to find that health facilities were never ready to begin with. Who then takes accountability for that, for the infrastructure, for the healthcare workers' safety? The issue of danger pay and overtime pay is also an issue that should be collaboratively responded to by you and the Minister of Finance. As part of the executive, the minister must not tell us about the Solidarity Fund. The country cannot run on charitable aspirations. We need the state government, the Minister of Finance, collaboratively with the Minister of Health, to tell us exactly what is the situation in regards to money. You have not secured vaccines because you don't have money. The money was looted, the money was misappropriated, and today we have a situation where the country, the top 15 of countries in the world with highest infections, does not have money for a vaccine. And the government must take proper accountability in this fact, because you are coming against people's right to health care, which is a primary right for each and every South African in this country and people living in this country. We have a right to healthcare, and the fact that you have not delivered a vaccine, the fact that you have regressed the National Department of Health, means that you as a government have come against our primary right to healthcare. And to date, nobody has taken accountability for the fact that the state is directly responsible for the fact that we don't have quality access to healthcare. So can the minister also respond to that in the fact that how does the National Department of Health, how does the executive, how does the Minister of Health and the National Department of Health take accountability for their failures and regression, especially in relation to the pandemic, because now we are sitting as a country not having a vaccine because we have failed.
Mama, Honorable, is it Tigeledi Shabalala? Please switch off your mic.
Lastly, Chairperson, it is very important that we have Treasurer and the Minister of Finance to come into this portfolio committee and tell us exactly why they do not have the money for the vaccine.
Honorable, is it now? I don't know where is it ringing. Is it ringing when you Chirwa or?
It is ringing on my side as well, Chairperson.
Hey, okay, it is telling you to round up now.
All right. Just lastly, we need the Minister of Finance and Treasury to come and tell us why they do not have money for a vaccine, where they will get the money, how much money we need to ensure that all South Africans have access to vaccination, especially because the National Department of Health cannot be trusted with their own targets. We know the portfolio committee, HIV, AIDS, ARV targets are set year in and year out, and none of them are reached. Mental health targets are set in year in and year out, and none of them are reached. So what then do we then have as evidence that even the rollout of vaccination will be a target that is reached by the department that has consistently failed for decades, 2 decades to be exact, to reach any of their targets consistently in this country? Thank you, Chairperson.
Yeah. Okay. The first 6 honorable members needed 45 minutes to pose their questions. Now, if the next 6 members also pose their questions in 45 minutes, then we'll have no space left for the minister to say something and the MECs. So may I plead that we actually concrete, sort of make a concise contribution in the light that some of us have already made the 6 of them. So, honorable members, the following will then be speaking. Number 1 in this group is Honorable Sukers, followed by Honorable Dr. Tembekwayo. The third will be Honorable Kela. Number 4, Honorable Imam Sheikh. Number 5, Honorable Mama Shengwa. And then 6 will be Honorable Sokacha. While the honorable members are preparing, let me just mention this, taking it from Honorable Kwahube. I am actually going to maybe comment on your, I think, very strong suggestion with regards to regularizing our meeting with the minister. But that is assisting me to maybe make a correction here on what Honorable Wilson said. This meeting is not called because we were actually asked by the speaker to call the meeting. You are correct. We started the process of getting this meeting in place. I did not leave it to the staff members that I work with together with the staff of the minister. I personally was phoning the minister in this regard. And we were trying to get a date for that process while the minister is also traveling the whole country to do that. And when we were almost getting there, firstly, you then have to write a letter. If Parliament is in recess, you have to mobilize your staff to be available, write to the House Chair, request a meeting, wait and get a response. While that was actually almost finalized last week, there was a bereavement in my family. It was not easy to deal with this matter while my brother's wife was buried yesterday and he was in hospital, and I had to deal with that and deal with those issues. So the earliest I could get this meeting on was today, this morning, after the funeral we had yesterday. So I think we should actually be saying the 2 weeks delay was not because we were not aware of the pressures that we must get together as a portfolio committee, but maybe the concrete suggestion made by Kwahube, I may comment on it as we close in terms of regularizing our meetings and updates with the minister. Let me start then with Honorable Sukers.
Thank you, Chair. I'm not sure how we would get through in 45 minutes through everything. There was a request made for the meeting to be extended. I just want to hear from the Chair if that is possible.
I'm not aware. I did not check that with the minister because he has other pressures beyond 12 o'clock.
In that case, I'll continue, Chair. Firstly, I want on behalf also extend and support the extension of condolences to the family of the late Dr. Jantjie by the Portfolio Committee on Health. Dr. Jantjie's humility and a respectful manner of engagement served as a huge encouragement for first-time MPs such as myself. Chair, we need to acknowledge that across this nation, people are in mourning. And it puts a greater responsibility on us as public representatives to do our duty. And it is for this reason that I want to support the call for more effective communication between the Portfolio Committee and more regular updates between the department, the minister, and the Portfolio Committee. We must also emphasize, I also want to emphasize, Chair, what why the meeting was called for by many parties on the Portfolio Committee. The situation facing our people on the ground is the reason parties on this committee called for the meeting for over 2 weeks. It is the number of deaths in our communities and the situation in our hospitals that are putting immense pressure on health workers. It's therefore that we ask that MECs be present, especially of the hotspot areas, to give us an update on what is being done, especially because we are going in some provinces now towards the peak of infection. And so it is very important that we need to look at what we faced in our constituencies. We've had people dying, Chair, dying because ambulances couldn't get to them in time. As public representative, I personally drove COVID-infected patients to hospitals to try and save their lives. The situation is traumatic for us that just as a matter of our work, just sometimes come in contact with the cold face of this disease. How much more for the many nurses and doctors that are now needing to rotate oxygen machines with patients and needing to decide who will live and who will die. I want to emphasize, Chair, that is the reality for South Africans. The vaccination is months away at best. So the current situation on the ground is what we need to address and that we need clarity on as to how are we going to deal with the coming weeks to ensure that people do not die unnecessarily. We've experienced untimely and unnecessary deaths of many breadwinners and loved ones due to the systemic failures and the glaring gaps. And we owe it to South Africans to demand that the committee not only be updated, but also that we now be told how optimal treatment will be provided in the coming weeks and how support will be given to healthcare workers. I have a number of questions and I'm quickly going to run through it now. The first thing that I as a public representative struggled with was how to get sick people that lives in shacks to quarantine sites. That information we need, because there are people who are deteriorating at home because of a lack of ventilation. They are ill, they are sick, and they are moderately sick, but they become severe because of the circumstances that they live in. So we need the information on quarantine sites and how to get our people to quarantine sites. Secondly, Chair, there are two critical issues that are affecting deaths. The one is people do not know when, people do not go to hospital in time. People are unable to monitor. They're not middle-class citizens who has an oximeter, who can check their oxygen levels and all of that. People do not know. They wait until they are in respiratory distress. Then they go to hospital, and by that time, they can't find an ambulance. They are and when they do get an ambulance, they get to hospital and they need to wait in queues. So a comprehensive community campaign needs to be started by the department. And I want to ask the minister urgently to please tell us what plans are in place for a comprehensive communication campaign that will ensure our communities are informed about COVID, the symptoms, and what to do to ensure early treatment. Because early treatment will mean fewer critical cases arrive in casualty. Secondly, in terms of home care, when patients are sent home after a COVID diagnosis, they don't know what to do. They don't have adequate information how to take care of themselves. And many people has died in my constituency, sir, that were lying in their houses, and no one wants to take care of them because they're scared of COVID. Secondly, those people do not eat, they get dehydrated, and those people die. What information packages does the Department of Health or have they designed that patients can take home? Have you considered podcast? What are telemedicine options that we can make available to communities? Then in terms of palliative care, I had 74 and 92-year-old people dying at home. Our hospitals are overwhelmed and people have been triaged, even in terms of ambulances. So elderly people with comorbidities are being collected last, if at all, by the EMFs. In these cases, they have to take their chances at home. What plans have been made for community-based care, even if it has to be palliative? Then, Chair, two things that I will go to. Within the hospital system, where do most deaths occur? In district hospitals or main hospitals, such as Tygerberg or Groote Schuur? And how many deaths are due to comorbidities and not directly COVID? Then, in terms of ivermectin, a number of patients and clinicians would like to use this drug. The efficacy of ivermectin is a subject to a number of clinical trials around the world. Has the Department of Health aware of any trials being conducted in South Africa? And if none are being conducted, why not? Will the minister liaise with SAPRA to explore if emergency use authorization can be obtained for ivermectin where patients and clinicians wishes to use the treatment? Then just lastly, Chair, we are aware that you are unable to test sufficiently for COVID-19. Given that the current rate of infection and community transmission in many places are out of control, how many South Africans have been exposed to the virus? And what percentage of the population had already been exposed? What programs are you planning to determine this? Then I want to ask, Chair, how effective will the current vaccine candidates be against the new South African variant of COVID-19? What studies are underway to determine it? How soon will they be completed? And what mechanisms are in place to ensure this research informs our choice of vaccine candidates? Lastly, it is important to note that there are moral and religious considerations for many South Africans when it comes to vaccines. Are vaccines going to be compulsory? And secondly, will the content of such vaccines be made public? Will the department source a vaccine that does not use aborted stem cells in any stage of its development? I have many more. I'll stand with that. Thank you, Chair.
Thank you, Chairperson. And let me join other honorable members by passing condolences to the family of Dr. Janti. May her soul rest in peace. To the Minister, I just would like to reiterate on the letter from the Chief Whip of Economic Freedom Fighters, and to say the reasons why we need Mr. Tito Mboweni and the National Treasury to be invited for the forthcoming meetings. It's for them to engage on all questions pertaining to the funding. That is very important, and we ask the Minister to adhere and respect our request. On question number 2, is about the electronic vaccination data system, which is in process. And to say to the Minister, we have in the past major existing digitalization problems in the public health care services. How will it be done? How will it be maintained or managed significantly? And further to say to the Minister, mention was made of inquiry into the matter of pregnant women and others like HIV and diabetic people, but to say there's a lot more different populations that may respond differently to the vaccine depending on their genetic and other factors. We just would like to have a list of all those that will be investigated, not only the 3, especially when it comes to administration of the vaccines. The following one is in connection with negotiations with vaccine manufacturers. And I would like to say there are some advantages and disadvantages that have been mentioned on different vaccine manufacturers, like for an example, the Pfizer, where they say 2 doses and the effectiveness thereof and where it has to be stored. But amongst those vaccine manufacturers that have been discussed, there was mention made of Johnson & Johnson, whereby only a single dose is sufficient. And the advantage thereof is that it's much easier to administer and more cost effective. And then to ask the minister, how far are you with the negotiation with the Johnson & Johnson? And going further, to say that various universities in South Africa were engaged into studies to reduce COVID-19. Has there been any interest from your department towards the studies? If yes, please explain. If not, why? For an example, we have University of Pretoria, which has a transdisciplinary team from its Faculty of Health Science and Department of Mathematics and Applied Mathematics that is engaged in modeling of the pandemic in South Africa. It's just one of them that I can name. Following question, while vaccines and cure are still pending, why is the department not advising the poor public to supplement non-pharmaceutical interventions with the intake of immune boosters to stimulate one's immune against the viral infection? The minister made mention of vaccine card, but I just want to, vaccine card and the 2 doses. I just want to ask the minister whether you are aware of a form that is in circulation on the media that deals with the agreement form. The agreement form, the conditional acceptance of vaccines, agreement between the vaccine provider and vaccination party. Oh, somebody's disturbing me. And most importantly, to concentrate on the declaration, the stipulation, the terms that are mentioned there. One of them that says, I am aware that the vaccine can cause death and injury. And then to say, if ever there is a form in circulation, can that form be made available to us? Because I don't believe it's only the vaccine card that plays an important role here. It's a form that people need to sign in agreement of taking the vaccine as it may be. And lastly, to say our healthcare system were not designed to deal with crisis and unpredictable large-scale healthcare challenges that requires urgent mobilizations of resources and affect the whole population. There is a physical and mental exhaustion of healthcare workforce, along with worn-out hospital infrastructure and growing backlog of healthcare procedures. How will the minister address this challenge together with the matter of the urgent vaccines? And lastly, the president, when he was addressing the nation on the readiness of vaccine, he said, the money has been paid for vaccine, but it will only come in April. Who is who? This February said by the minister, this April pronounced by the president, Who do we believe in here? Thank you, Chairperson.
Thank you very much, Chairperson. Thank you much, Chairperson. Chairperson, let me also send my deepest condolences to the family of Dr. Janji. Indeed, she was a mother to us in the portfolio committee. We have lost a comrade in our portfolio. May her soul rest in peace. Coming to the issue of the briefing, let me welcome the briefing from the Minister of Health, and we really appreciate Minister for coming to the portfolio committee and brief us as a portfolio committee. Firstly, Chair, I want to say, Chairperson, there was an invite to us as portfolio committee to go to Eastern Cape and do oversight, as we have heard that the numbers are increasing and the Eastern Cape is a hotspot. None of us has availed herself. Everybody was having an excuse commitment. Some portfolio members were saying that they have a commitment. Some of them were saying that they have elderly people who are staying with them in their home. I think, members, this is our task, all of us as portfolio members, to make sure that we work together and also we do our oversight role to assist and engage with this MEC, because if we went to Eastern Cape, for instance, we were going to be able to engage with the MEC for health in the Eastern Cape and also ask some questions and assist where we can assist as portfolio members. Let me go to the presentation. Minister, I really welcome the presentation, and really I'm very happy that you are also involving leadership and coordination of all stakeholders so that at least everybody must be informed, especially the civic society. And also the other issue that you will prioritize the health workers. Really, they are exhausted. Some of them are in quarantine, some of them are in isolation. I think that is a good move as a health department to start with them so that at least we know actually that they are health workers, they are doing a good job to save the life of South Africans in our country. The other one, it's an issue, Minister, that Minister, we are very pleased that there are over 7,000 community service healthcare workers, including doctors, that you announced are joining the workforce this year, and this will help the department. Similarly, to add to the 14,000 healthcare workers employed last year, but we are a bit worried about there have been increased with the absorption of healthcare workers who have completed their community service due to fiscal constraint. What can be done to absorb all post-community service professionals who wish to work in the public sector? The other one, Minister, we note the AFROX agreed to increase their production in the Western Cape. We appreciate their contribution to save lives of South Africans people, especially thanks to Dr. Kenneth Jacob, our portfolio committee member, and Dr. Chisani for engaging the AFROX with the shortage of oxygen in the province, in that province. We realize there is a challenge with the oxygen in our country and we need urgent intervention. And as a portfolio committee, I think as a portfolio committee, we need to have to work together and also to make sure that we deal with this issue, because really it's a matter of the portfolio of health, the issue that we are dealing with. We must handle it as a portfolio committee so that at least we save the life of the people of South Africa. I thank you, Chair.
Thank you very much, and thank you, Chair, and thank you, Minister, for the presentation. Let me start off by saying, Minister, I am extremely disappointed, because the first thing I expected was that you were going to acknowledge and talk about the legal action that various persons are taking against the department, particularly on the issue of ivermectin, but I'll come to that shortly. First of all, I think you'd like you to tell us, the Indian government is talking about banning the export of the vaccines because they want it to be used in India first. Can you tell us exactly what the position is going to and the impact it's going to have in terms of your rollout plan if those vaccines are going to be banned by the Indian government and not allowed? Taking into consideration you've got no other procurement agreement in place with anyone else at this current stage, don't you think that it is being too optimistic in expecting these things to be here in the second quarter of 2021? There is also some indication, and I've just received some reports of the Pfizer vaccine and the ineffectiveness of the vaccine as well, or the lack of effectiveness of the vaccine, and I don't know if you'd be able to comment on that. But Minister, my understanding is that the National Department of Health has a responsibility in South Africa to protect the health of its citizens and those living here, even if they are not South African citizens. Now, I am in no way, I'm not wanting to sell drugs. I don't manufacture drugs. So, you know, your department asking me whether I will put an application to register a particular drug, I think it's totally unacceptable. Totally unacceptable. My job is to do oversight as a public representative. But let me start off by saying this. Now, there is this drug called ivermectin, and I'm in no way saying that you must take ivermectin and stop everything. You continue social distancing, you wear your mask, you take the vaccine, you do everything else. But the evidence that is unfolding on an hourly basis, you know, internationally, I mean, you've perhaps heard of Dr. Martin Gill and what he has to say in terms of the research he has done. Professor Thomas Barodi from the Victoria Hospital in Australia, 100% success rate he talks about. In the United States, 14 trials, 100% success rate. China, 60 out of 60, 100%. Very few side effects they are talking about. Now, and in the north of Australia, 100% cure rate with 4% headaches, 24 hours response. That is what they were saying. You've perhaps heard of Professor Pierre Corey from Wisconsin in the United States of America and the success that he's talking about. You've heard of Paul Merrick, a professor in medical critical care. What he is saying about the evidence. All we have been asking, why is the National Department of Health not sitting with SAPRA and reviewing the latest evidence and research that is available so that we can look into this? Now, we must admit there is a crisis in South Africa in terms of the number of people. Over 840 deaths yesterday alone, average of 500 every day, 22 or 23,000 infections yesterday, 17,000 on average on every single day. But there is overwhelming evidence, and I can tell you medical professionals in the healthcare all said they have been taking the drug with a 100% success rate. And I'm not saying it is 100% success. All I am asking is, why is it so difficult? Minister and my colleagues earlier on alluded to the problem we have in terms of communication with your department. You can never get hold of anybody. I've been battling for 2 weeks. I've spoken to the DDG. I've spoken to your chief of staff. SAPRA will never take the call, not the CEO, not the chairperson. your DG himself, his phone does not take any messages. We are on the ground. We are the eyes and ears of the people. We know what is going on, but we cannot get into contact with anybody. There's trials being done in the US, clinical trials in the European Union, very successful. India, Bangladesh, the United States has got 38 trials that is continuing right now. Now, the World Health Organization sponsored a preliminary review, which through the University of Liverpool, and alluded to that. Reduction in the mortality rate. So, what is the problem in sitting down in state capture? Is this the Minister? Can you tell me soon how much is SEPRA being funded and who is funding SEPRA? Because now I'm beginning to wonder, why is SEPRA adopting the attitude that they're adopting, that they don't even want to look at the review? Now you come up with one or two, and that is what SEPRA has done. But there's tens and twenties of
Honorable Sheikh.
Yes, Chair.
Honorable Sheikh.
Yes, Chairperson.
Your camera is sitting up. Your camera is sitting upside down.
I don't know, because
I don't know what. Yeah.
I don't know why. Let's have a look now. No, it's still there's something wrong. Mine is perfect. Yeah, I don't know what's going on.
No, sorry, Chair, to interrupt, but on my side, the honourable member's camera is correct.
Yeah, on my side, it was correct. Is somewhere else is showing as the wrong one. So, okay, continue, Honourable Imam Sheikh.
So you know, Minister, my understanding is this, and let me go further. You, in your own submission, Minister, said the other day, the vaccine is not registered in South Africa, but we've ordered it. We are going to be receiving it. Now, in terms of Section 21, could we not be looking at this? Could we not? And all I've been asking for, and that's why I had to go the legal route, is to get an audience with you, Minister, because through your department, we can't get it. Together with health experts, I'm not a health expert. No, I'm not. I know very little or nothing about health. To get these health experts to sit with you, with SEPRA, with all the evidence that is available and recent, to look at side by side concurrently while we're looking at getting this vaccine, we can perhaps save lives, because everywhere it is taken, 99% of the time I'm hearing from people, it's all providing positive results. That is all I'm pleading for. Can we not do that? Are we not? What is the difficulty in being able to sit down and look at the evidence before us? Now, let us not go back to evidence that was 6 and 8 months ago. Now, let me say this as well, Minister. You know, we've got a problem with HIV and AIDS in South Africa for 20, 30 years. We've never found a vaccine, right? But here's a vaccine we found in 6 months. Now, what happened? Where did the ivermectin coming from? It's a 30, 40-year-old drug that's approved by the World Health Organization, by the FDA. Now, I don't want to hear that it is not approved for COVID-19, because the trials are continuing, but the effectiveness has been proven without any doubt. Now, all I'm saying is, if we can sit down, look at the research, and if we are satisfied it is going to save life, that is what it should be all about, then yes, indeed, we should introduce it in a controlled environment rather than people getting it illegally and things. So that is what my concern is, Minister. It is totally unacceptable that we cannot get hold of the people that we want to get hold of. Your department, your chief of staff threatens me because it's not his money. He threatens that he will punitive cost if I go to court. All I'm asking is, can we have an audience? If not, yes, we have to go to court to go and bring us together so that we can try and save lives in South Africa. That is all I'm asking for. So I'm hoping, Minister, you're going to address this issue today and give us this audience so I can bring the expertise and the availability of all these practitioners that's got the knowledge and and the technical know-how, so we can sit down and look at it. But what SEPRA is doing is they go ban it, they want to criminalize it, not even giving it a thought. And that's what makes me so suspicious. That's why I want to know who is funding SEPRA in the last 10 years. If we can have that report, I want to know what is. Minister, they've made a statement that they were going to release it for use in South Africa. And then hours later, they've retracted it with SABC, threatening SABC going to the ombudsman and things. So what is really going on? The only reason it is not being promoted by the people who invented it, let us not forget, this drug received the Nobel Peace Prize in 2015. Many people are talking about its success all over, including FDA. Now, the only problem with this drug, it is cheap, cheap, cheap. Nobody's going to be making any money, but this cheap drug is going to do magic and save life. if it's going to work. But I leave that in your good hands, Minister, with your team and with SEPRA, with the experts. That is all I want to say.
Mama Shengwa.
Honorable Chair, let me first pass my condolences on the behalf of the IFP to lose our veteran member, Dr. Jansi. And also to you, Chairperson, you lose your member at home. May their peace rest, may their soul rest in peace. Honorable Minister, let me have a clear clarity on this. It has recently been reported in newspaper in the United Kingdom that the current vaccine again, the now COVID strain in South Africa, are ineffective. Can you give us further information as to accuracy of this statement and the possible delays it might cause in the rollout of the effective vaccine in South Africa? The second one goes to MEC in KZN. When you listen, the MEC in KZN, she is always talking about the ready. They are ready, but in KZN, people are dying left and right. I'm talking about the Zululand alone. That where our clinic are not capacitated. When somebody came in the clinic and the clinic said, oh, COVID, no, don't come. They even not attend or give them a space to wait for an ambulance. They say, don't come. The other one was just at the gate and just died there because people were not known now where to go. In Bungamhlope Clinic, the family, mother and the father, they were not COVID case, but they are commodities. And the Bungamhlope Clinic doesn't apply the 24 hours. They say go to Nkonjeni Hospital, and when they didn't even reach the Nkonjeni Hospital, and many more. But in every time, Minister, when MEC come to address, they say they are ready, while in the grassroots they are not ready. That's what I want, the clarity of this readiness, because we are getting tired of the readiness, while in the clinics, in the hospital, they are not ready. Thank you.
Last one is Honorable Sokacha.
Thank you very much, Honorable Chairperson. Let me also join my colleagues to send our condolences to the family of the Honorable Janki, and also all those honorable members who have been affected by the scourge of the of COVID with their family members. Let me also thank the Honorable Minister for the presentation, and also say thank you very much to him and the good work that the department is doing himself, the Deputy Minister and his team. Honorable Minister, I've got a few questions. Some have been asked by the honorable members already. The first one, Honorable Minister, is the issue of the communication around the vaccination of our patients. I'm very much pleased to hear that the program might start as soon as in February. But I'm worried, Honorable Minister, that the communication of the vaccination is still very low, and our members are very scared of the vaccination. I just want to check what is the rollout strategy that the department is having to make sure that they are going to educate our people around the vaccination. The second one, Honorable Minister, is around the Sputnik 5. I just want to check, why is Sputnik 5 not recorded? Are we not considering it, given that a number of countries have already received millions of dosages and its trial results stand at 91.4% higher than all those that you have mentioned in the presentation? What is our stand as a country around Sputnik 5? Then the last one, Honorable Minister, I am in Richmond, in my hometown, a very small community. And the infection rate here, Honorable Minister, is so high. It stands over 100, which is too many for a community like Richmond. And my only worry, Honorable Minister, is that our frontline workers has been affected. Last week, we buried one sister, a nurse here, who was infected, and she died. And the community healthcare center, the CHC, has been closed now for the evening activities. It's closed during the evenings because there is no staff, because most of the staff members are tested positive. So they've closed it now. It's no more opening 24 hours. And Richmond is along the N1, and we need that 24-hour service. Now I'm worried because most of the staff members, the frontline workers, are affected. And I'm pleased at least the Northern Cape government is doing an outstanding job. But the only thing is just the cry that the community is having. Now, if somebody got sick during the evening, he has to be transported by an ambulance to Victoria West, which is about 120 km from here, or he has to be transported to DR, which is also another 120 km. And even those hospitals are not adequately equipped. So we are very much worried about our CHC here, who is closed because of the shortages of staff. Thank you very much, Chairperson.
Okay.
Honorable Chair.
Thank you very much, Honorable. Yeah, no. Thank you very much, Honorable Chair. Honorable members, we would have to actually check with our staff if we can have another 5 minutes just before we finish at 12 o'clock. No. Honorable Munyai, let's not discuss this matter that I'm discussing with you on the side. Let me then say there are 3 points I'm going to raise that Minister may actually is strengthening what the other honorable members have just said. The other 3, I'll try and raise them in my closing remarks. The honorable members, the letter from the EFF Deputy President is to us. We will process it appropriately because it came in on the 11th hour for this meeting. It has substance, which we cannot ignore. But let me then say it's probably not so much a responsibility of the minister to prepare. It's a letter addressed to parliamentary processes, which we'll have to actually support. The communication minister is coming in very strong from the members that maybe there is a lot of information out there which is not really well known or being twisted by members because members of the society because they are not well informed. Please, if you can look into that matter. But the third and the last point before we allow minister to respond, well, we are getting members to respond to another 5 minutes additional time because the minister may just have 50 minutes or more. And that is that Honorable Keller was correct. I think our oversight is not limited to getting the minister to come with us and sit with us here and we listen. Our oversight is to go and see for ourselves and see collectively. Members were declining their availability to do, even before the president declared these areas as hotspots, we were picking up that there are challenges in the Western Cape, Eastern Cape, and we made a plan to go there. None of the members were available to do that. I even spoke to the chief whip of the majority party, and she said, look, it's not advisable that you go alone and you call that a portfolio committee oversight. So we left it at that. So we need to also up our games to say, where do we get access? Where do we get information? Should we only call the minister to come to this meeting, or do we also not collectively do our groundwork and be on the ground and see and hear what things are happening? So that is to us more than to say, Minister, we always want you to go there, out there, come back and tell us. Honorable Minister, can you then come to these lengthy questions that were raised with you and respond?
Thank you very much, Chairperson. Could we just indicate I do have a commitment that I need to move to, so we will try and respond as quickly as possible. I'm going to ask that DDG Dr. Anban Pillay take the first few minutes, say about 10 minutes, to deal with most of the issues that they can deal with. I'll come in after that. Thank you very much. Dr. Anban Pillay is on the platform.
Thank you, Minister, Chairperson, and honourable members and colleagues. I'll deal with some of the questions that were raised. I think the first question was around the bilateral meetings. We had bilateral meetings with all of the manufacturers that are currently having vaccines available. We started with those meetings in September in most cases. There were one or two meetings before that, but they were not formal as such, because there was nothing concrete to talk about in terms of the vaccine. So I just want to say that the article in News 24, I think it was, is wholly inaccurate. I even contacted Johnson & Johnson to establish as to is there some misunderstanding between us. They're not aware of a meeting that we cancelled with them, neither are they aware of any disputes between us. We've been having fruitful discussions, and I think we will probably be able to confirm details of our agreements later. But there is no veracity in the claims that we've cancelled meetings or there's disputes between us, as is reported in the News 24 article. And I think Johnson & Johnson did reply to the claim as well, to the journalists, so but it seems it wasn't reflected that way. On the question about the vaccine being unaffordable, I did check with my colleagues in the presidency about this. I think there seems to be a misunderstanding. What was said was the vaccine is expensive. There is quite a big difference between the two. And certainly the Pfizer vaccine was quoted as $10. And as you know, there are vaccines that are at a much lower prices, which are in the public domain. So the response was largely about a vaccine being expensive, not about it being unaffordable. And certainly when we do procurement, we will look at the cost effectiveness of the vaccine as an important consideration as required in terms of the PFMA. In terms of the intern placements, I can say that all of the interns, the medical interns, have been placed. So have the community service doctors as well been placed. My figures, I just looked into the system very quickly. We have about 1,800 interns that have been placed, and around 2,355 community service doctors that have been placed, and all of them have been given placements. So there is no outstanding issue on that. In terms of the access to beds, there has been severe pressure on the beds, particularly in private hospitals across a number of cities in the country. And they have been working very closely with the provincial departments of health to try and assist with the beds. So I think many of the provincial departments will be able to confirm the details of patients being transferred across. But we continue to monitor the situation and working with our colleagues in the private hospital sector to make sure that beds are available in the public sector where there is pressure in the private sector. On oxygen, we have 3 oxygen suppliers in the country, and there was a time at which one of those oxygen suppliers had difficulty supplying the full quantity of oxygen to the Western Cape, and that issue came about for about 2 or 3 days, but the supplier has now rectified much of that, and I think the HOD from the Western Cape can confirm things are much better now around that. But as the demand for oxygen and hospitalization increases, this will place a strain on oxygen supplies. There isn't a shortage, but if there is a breakdown in the oxygen equipment, etc., this will cause challenges. On the question about communication, we have quite an extensive communication strategy, which includes production of pamphlets, people going out to communities and through loud hailers, providing information, production of posters electronically, as well as short videos that try and explain in various languages about COVID, about the protection, about what you need to do when you are sick, etc. But I think we certainly will have to deepen the extent to which people are accessing this information, because it's critical that people know well in advance that they need to go into facilities early. So delaying going in is obviously has catastrophic consequences. On the question about us working with the universities and specifically Pretoria University, each of our provincial health departments have a close relationship with a number of universities that are supporting them in the COVID response, particularly on the research and analysis and the like. I know that Pretoria University has a very close relationship with the Gauteng Department of Health, and it's part of their response team and advises them on the analytics that they are doing. And then finally, Minister, maybe I should just share a little bit around ivermectin. I know the Honourable member has raised with me on a number of occasions about the difficulty. Just to explain the point that it is a mandate of SAHPRA, not the department. We have looked at the trials, and I think it's fair to say there is much academic debate about its effectiveness or not. In my engagements with SAHPRA to try and find some solution to this problem, the discussions that we've had with SAHPRA suggest that maybe a solution is to have a phase 4 clinical trial structure, which would allow patients to access the drug, but there to be a controlled reporting of the experience of patients, both in terms of the effectiveness as well as safety. We'd get a better handle on whether this product works, how well it works, and if there's any safety issues around it. I hope that somehow this can be resolved with SAHPRA, because I know that that is the expressed opinion at the time when I engaged with them. Thank you, Minister.
Thank you very much, honourable members and honourable chairperson, for all the questions. Once again, condolences to you as chairperson on the loss of your brother, and of course the honourable Gomba, MEC of Eastern Cape, for on the loss of her mother. The questions, just briefly to try and respond to some of them. Let me say I do accept that there's a need for regular update between the ministry department and the portfolio committee, that you will find that we are ready to come in whenever the arrangements can be made, so that we can share that. I do accept that the members who feel that there's been a gap, too many things have been happening, that we need to find a way to close that gap, and therefore want to give support to that suggestion. The next question relates to the specific complaints that are relating to specific hospitals. It will be useful. You've got most of the MECs are on the line. We would ask them to actually follow up those issues, but where it's necessary, we could pick those issues up with the member directly, so that we can share on where you've got specific issues. Don't be uncomfortable to send us the direct communication either to the MEC or to the minister. We'll try and address those, because we do understand the situation is pretty difficult at this stage. There's lots of pressure in the community amongst our health workers. Everyone can feel the pressure of the resurgence, and therefore you will not be blamed for raising the issues where you are coming across individuals, because all of us now are having specific personal experiences where we have to deal with individuals, with friends, with relatives, with neighbors, with the public, who are all complaining or who are raising issues out of the fact that the numbers of people who are testing positive, the numbers who are getting to hospitals, the challenges in hospital, all of that is higher. We have to acknowledge that upfront and say that what you feel is what we're all feeling. We have to just try and work together to try and help our country through this difficult situation. We did say, yes, we were ready. And of course, we just indicated that the surge that we are showing now is much bigger than what we've seen before. And therefore, strains are going to be felt somewhere along the line. And we have to really continue doing whatever we can to make sure that we can save the lives of our people. Any life that might be lost is lost. Mainly because it's unavoidable. It really is regrettable at any one time that we should lose any life that could have been saved. So we will really continue to express our commitment, and particularly our health workers are very much under pressure, but their commitment and dedication is still appreciated, and the work that has been done that they've done at this point. So we would want to just plead for cooperation, working together to try and resolve some of the problems. Where we can find information, we will share. Then the specific issues that I'd like to just touch on. One, the issue on the Western Cape of the Premier of the Western Cape wanting to procure vaccines. Well, I did raise the issue with them that in fact they indicated that they were ready to deal with the vaccine, but we have actually since convened the whole National Health Council with all the provinces, and agreed on the approach that we're going to be securing the procurement centrally, and that is mainly because most of the manufacturing companies would rather deal with governments. I think maybe in another few months that might be a bit more open, but that's been our impression at this point. So we will be doing central procurement, which will cover really the country as it were, and most of the countries are doing almost the same thing, that they procure for the country, and then of course the internal mechanisms of distribution are internal to the various countries. There are issues, challenges in the border. We're getting lots of reports. I don't have any update right now, but we have asked that there should be a review on the whole approach to the port health authorities at that level, and in particular the question of testing. We're actually going through that issue. So when we've got a decision made, we will make a public statement at that point. But we are aware that there's quite a lot of a challenge at that level. We have also indicated the issues that relates to the vaccines. I'm not sure if Honorable Kwahube wants me to repeat this whole thing of the vaccines that we're looking at, but we're already in the presentation given that whole list. So if you could look at it, and if I'm not happy, then of course we can pick it up separately. But we have indicated that we have dealt with Moderna, Pfizer, AstraZeneca, J&J, and Sinopharm, and those were the main ones that we'd actually been looking at. We did go through that presentation a bit earlier on, but we can go through it if there's need to do that again. The vaccine will be voluntary. We'll try and urge as many people to take the vaccine, but vaccines are actually not mandatory. We just need the community to understand that it's for their benefit, and therefore they need to participate at that level. So where there are issues that relate to moral, ethical, or religious objections and those kinds of issues, we can deal with those at the time when we meet those situations. But where we are, the vaccines are going to be offered, really more for the common good of all, and therefore we're not going to be, they're not going to be mandatory to anyone, but we will actually like to see everyone taking up the vaccine. The question raised about whether the vaccines will work. Actually, the vaccines do work, and it's not the only one on COVID. We've dealt with that on polio, on tetanus, on what called measles, etc. And so all of these, they actually help to save the community from kind of infection. The issue about the council meeting having delayed the arrival of the vaccine, I think it's a ridiculous statement, but because it has been responded to, we'll not waste time with it. The point is that we've actually been hard at work to make sure that we secure vaccines for the country. And so everything else is all part of the mechanics of managing things. And so we don't think that they should be taken out of context. So we don't believe there's been time that's been wasted, nor do we ever believe that there's any need to take a government to court, because government is actually committed to provision of the vaccines, and we'll move on in that regard because of our duty and responsibility over the public. And so those who have got concerns, we'll try and explain to them so that they can see that we're all on the one side here. We don't have two sides on the issue of COVID. Some have even suggested there's denialism, and of course that's completely out of context, because there's no one who's denying. There's clearly a science-led process here, and so we will deal with it from that perspective. I think what we must accept is that there's a lot of anxiety and uneasiness, and people are also, worrying about a number of things. That's why we've had quite a lot of public concern that we have noticed. Then the question of financing, the acquisition of vaccines will be funded largely from the fiscus. We have accepted that there will be support that will come from private sector in terms of business and donors, also in terms of medical aid. But government is not relying on charitable sources. We have actually got the fiscus to carry this, and this would have been the response that the Minister of Finance would have given at the time if he had been here. We're not at liberty to release any kind of figures here. All I can say is that between us and the Department of Treasury, the funds we need to raise, to purchase, to procure the vaccines will be made available, and so it's a matter of how we deal with the details. The issues raised by Honourable Sakers about the challenges of having to deal with individuals who are sick and having to deal with them with the anguish and all the pain and so on, we do appreciate and understand. I think, as we have indicated, all of us are going to come across that situation because we're going through a really difficult time. However, we must say that we must continue to work together and share whatever information that we need. Now, there's a lot of information that's being requested about hospitalization numbers, beds and ICU and so on, that we need to just prepare and give a proper presentation, because we won't be able to do justice at this point. Then the question raised by Honorable Tembekwayo, there were 2 days given. The date that the President gave, he indicated that the COVAX timeframes were saying that we should have our first vaccine from COVAX facility around April. That is the timing of the COVAX facility. Then it's only 10% that we committed to COVAX. We are raising the rest of the 57% of the vaccines, and this is when I said we are looking at earlier delivery. So I'll come back to that issue, because there is nothing wrong here. We're basically saying that we're trying to do everything we can to bring the thing. I'll come back to that just in a minute. Just to raise the issue that Honorable Honorable Imam Sheikh has raised. There's no banning of exports. The matter was in the media. It has been corrected. You will understand when I come back with in the next after the next few points which I want to make. The concern was worrying all of us. I think we dealt with it. I do want to acknowledge the letter you wrote, Honorable Imam Sheikh, and the matter here related to the question of ivermectin, and in this case, the concern, all that they understand was the response was to say the matter, we're prepared to work with you and support as far as we can. We don't believe we need to go to court. If you give us all the information, we'll try and follow the issue up. We have then indeed taken the matter forward. We've been receiving a number of comments from a number of people on this issue on ivermectin. I can just read briefly for you that they did issue a statement from SAPRA indicating some of the analysis that they'd done. The first one I think was Dr. Hill, which was Unitate, who had actually done the analysis. They did a number of other analyses afterwards. Then they felt that they were not in a position to register it as it was submitted. But in fact, the Ministerial Advisory Committee also had a huge debate about it. And so they also felt that the stance taken by SAPRA was correct. So the latest, after review, because of the issues you raised and the fact that we had to intervene to say, okay, relook at this issue and come back and tell us after these additional appeals have come. So I just want to quote briefly that there are currently, this is from SAPRA's response, there are currently no applications either for clinical trials or for the registration of ivermectin for the treatment or as prophylaxis for COVID-19. However, SAPRA encourages and supports all well-designated, ethically approved scientific studies designed to identify new or existing medicines that are used in the treatment for and prophylaxis of COVID-19. SAPRA reiterates its commitment to expedite the review of such studies. We'll send you the statement, but in reality, there's nothing stopping a special arrangement to actually apply under the supervision and the doctor taking responsibility. That's how they'll have to deal with it. So I think when you start saying that SAPRA is captured and who's financing, I think you're taking it a bit far. I think you should come back from that because it is not correct. I think what has happened here, you are dealing here with a situation where you have people who are looking at this matter. It's not political. It's completely clinical, and also the commercial interests get put aside. We just look at the science there. So I think I just want to assure you that there's no need for us to take it to that kind of extent. So I hope we can close that matter, and that Honorable Hlengwa, the studies are being done to look at all the aspects of this particular strain, the issues of vaccine sensitivity and issues of whether it's more virulent than the other one. Has also been, there's no evidence of that, but it has been seen that it's much more transmissible, like what we've seen in the other countries. So because it's a new issue, it's going to continue to be a matter in which is be focusing our scientific research attention. So let me just make this last statement as we get towards the conclusion. It's in line with our commitment to keep the public informed and of developments relating to the vaccine rollout strategy. We wish to communicate recent developments, therefore, of national importance. I did indicate that as I'm sitting here, a number of discussions are going on and some work is being done, and literally on an hour-to-hour basis. There's a new update every time. When we held the press briefing on Sunday, the 3rd of January, we indicated that insofar as our negotiations with individual manufacturing companies were concerned, we were bound by the non-disclosure agreements and confidentiality clauses that we had agreed to. We accept that this, and we recognize that we are in negotiation with independent private companies who may not want details to be disclosed until certain or all items and conditions between the parties are met. At the press briefing, I, as Minister of Health, gave an undertaking to South African public that we will prioritize the protection of the health workers by ensuring that they receive the vaccine by February 2021. At the time, I could not disclose further details. Today, I'm pleased to announce that the Serum Institute of India has given us permission to make public an announcement, a public announcement, and start engaging with all the relevant stakeholders in preparation for the rollout. In our presentation, we also stated that as a country, we've estimated 1.25 million of health workers, both for public and private sector, need to be prioritized. It is for this reason that today we announce that South Africa will be receiving the first 1 million doses of vaccine in January and another 500,000 in February from the Serum Institute of India. As recently as yesterday, our teams at the National Department of Health and the South African Health Products Regulatory Authority were fine-tuning and aligning all the regulations, processes, the regulatory regulations and processes to ensure that there are no unnecessary delays or regulatory impediments to activate this rollout. We are all happy that the Serum Institute of India and AstraZeneca vaccine has already been approved by various regulators and is being rolled out in other countries. Therefore, as part of expediting the regulatory process, SAPRA is applying reliance on that regulatory framework. We also want to inform the public that the acquisition has been done directly by the Department of Health. This strengthens the credibility of the process as all negotiations and payment issues are managed directly by government with other manufacturers. The concern that we've had with the PPEs is basically that there were many vendors that were to procure from. This is quite direct between government and the manufacturers. We will now be engaging all relevant stakeholders in order to ensure an efficient and effective rollout of the vaccines for our health workers. Because once it's in here, we have to be able to take care of both public and private sector, and we are meeting with private sector to look at refining the structures to ensure that the proper administration and allocations of the vaccines so that the relevant sectors are able to receive the vaccines accordingly. We therefore urge the public to be patient with us as we continue to engage manufacturers. Our commitment remains to save and protect the lives of our people. We will not neglect our responsibility to protect lives and also fight this pandemic. We therefore call on South Africans, members of the public and political parties, business, labor and NGOs, and community leaders and members to work with us as we start this historic process. Thank you very much, Chairperson. That is the end of our submission. Thank you very much.
Yeah. Members, at the time that I requested, we just over it by some few minutes. We just have another 5 minutes just for me to wrap up. Thank you very much. Let me say, Minister, we thank you for this response, starting from the presentation, listening to the questions, and now the responses. We welcome your input in as far as wanting to bring back our regular updates on the portfolio committee. So between our offices, we'll have to finalize that time slot as to how often we meet. But I'm also looking at the group chat here of our honorable members. We might, at another stage, Minister, request some of the officials just to be there with in their provinces, because maybe it would be easy to just get 1 or 2 provinces on a particular meeting just to exhaust and digest that. And so we will be finalizing that as to where we start getting the support from the MECs in understanding broadly issues. And I know Honorable Wilson will welcome that. We want to thank the MECs that have joined us up to the end of this meeting. Honorable MEC Nomakukus Melane, we hear the bereavement, the family of the MEC, but I noticed Dr. Zungu is here on this platform, and there's also the MEC from the Northern Cape. On the second point, Minister, we welcome your opening remarks again to say you to the Speaker requesting to make a statement with regard to the whole matter of COVID-19 and together the vaccine. I want to say to the members, the discussion that I've had with our Honorable House Chair was not that there was not going to be a special sitting in Parliament on this matter, but at any given time, it may be these members who will be actually engaging in that type of a debate. So this process of actually getting the minister to give us a detailed response and a presentation I did lose you there in preparation for the sitting. So I don't want the members here to leave with the understanding that there's not going to be any special sitting. There will be a delay so that we can also be appraised of the information that we are getting. So that is why that information was saying to the Speaker from the House Chair, please go and have your meetings. Let us get you to process these things so that we can call you. I'm sure our various parties will ask the very same members in this platform to be part of that debate. And therefore, it is not that it is completely thrown out of the picture, the special sitting to debate these issues. But the last one from my side is that we are also a portfolio committee that can engage with SAPRA. We will look into that. If there are issues that members would like us to engage SAPRA with, we are able to invite SAPRA to those issues. I want to thank you all honorable members and say we'll be processing all this, including the letter that I received from the EFF. It's not lost out of the system. And thank you for the robust engagement. And thanks for your response, Minister. We will, from now onwards, be able to engage and indicate how often we need to meet. But I think we need also to agree that we may still be meeting Minister probably not there, but engaging with MECs because there are issues that honorable members have raised. Lastly, I would like Dr. Zungu to actually speak to Honorable Kwahube, but also need to know about some allegation of bodies being exhumed in the Eastern because they are covered in plastics or this and that. That matter, I did not follow it very well, but there's a concern that we need to just to be appraised whether it is happening. And maybe also Honorable Noma Kukusmelane Zulu, MEC KZN, just to attend to that matter raised by Umama Oklengwa. With that, honorable members, we would like to thank all of you and thank the media, thank our staff for being part of this meeting. The meeting is now adjourned.
Thank you, Chair. Thank you very much.
Thank you, Chair.
Thank you, bye.
Okay.
Thank you.
Thank
Goodbye.
you, Chair.
Goodbye.
Bye.
Thank you, Chair. Thank you, Chairperson. Thank you.
Thank you, Chairperson.
Thank you.
Ngozi Stano. MEC. Yes, MEC.
Yapkin. Yapkin. Mkhize.